joining us now. We are delighted to have joining us on the line Steve Norris from the Greater West Bloomfield Community Coalition. Steve, hello. Welcome to the Splash Live. Good to have you with us.
Thank you so much, Dave.
Well, it's good that you're here, and it's great that you and your colleagues at the Community Coalition are working so hard for our community all the time and taking on difficult subjects. And right now, drug overdoses in our country are at an epidemic level. And it seems that whatever we do down on the border, I don't want to get all political, but we're just not getting the job done. There's a lot of drugs coming in, fentanyl and otherwise. And so what we got to do is, we can't stop it. We can't go on offense. So we're going on defense right here in West Bloomfield. And you've got a big announcement coming up for Friday. Why don't you tell us what the Greater West Bloomfield Community Coalition is up to?
Yes, so thank you for that. All that you said is very accurate. And to kind of get ahead of this, some of the things that we're doing in our community is we're rolling out what's referred to as Save a Life stations throughout Greater West Bloomfield. These stations will have the following items in it to kind of help with harm reduction efforts from the opioid epidemic, which include nasal Narcan for anybody to be able to access 24 hours a day, as well as testing strips for fentanyl. Also Deterra charcoal neutralizer for prescription medication, and a book of resources that basically connects our community members to resources for mental health and substance use disorder throughout all of Oakland County, if those people are looking to get connected to the appropriate partner that may be able to help them with those scenarios. The thing that makes this so amazing for us is that we have the ability, what we're referring to as low barrier. So these tools are available to the community free of charge. There's no stigma associated with having to ask for them. They can access these Save a Life stations at the particular locations whenever they need to in order to get those resources and those tools when they need them.
So Friday, you're going to be making an announcement here. Obviously, this is very exciting news about these stations coming to West Bloomfield. We'll talk about where they're going to be and how people can find out about where they're going to be in a minute. But let's talk about the practicality of this. So do you wait until you've got a problem, or is this something that you would want to prepare for? Visit one of these stations, get some supplies, and then have them available in the event that you might need them.
Yeah, that's such a great question. And we've had such massive efforts to educate our community on how to administer nasal Narcan in the event that our community have these situations that they come upon, and they'd be able to have this medication on hand and know how to use it based on the ability of being able to scan a QR code on the box and get their own training. It's so easy to do. It takes a few minutes, and it's just such an amazing opportunity for somebody to be able to save somebody's life in case of an accidental exposure.
So is this kind of like learning CPR, Steve, where you as an individual, not necessarily needing it for yourself, but you as an individual, a committed person in the community, might want to have these resources around. So if a friend, a neighbor, an acquaintance, or just somebody you happen to run into finds themselves in a dire situation, you can then come in and help them? Is that what we're doing? Okay.
Yes, and that's exactly what we're doing. And nationwide, we haven't decreased the numbers of accidental overdoses and poisoning due to opioid epidemic. But here in Michigan, just recently, I've learned that we've had about a 5% decrease in those numbers. And I think that specifically those numbers have decreased because we have done such a great job educating the community, and they've done such a great job stepping up and being able to jump into action when necessary.
Well, you take a look at the opioid problem that we have in our country, and you know, we've had a lot of drug scourges over my lifetime, no question about it. But this one is unique. The drugs, especially fentanyl, that's out there right now, is deadly, is readily available, maybe more available than virtually anything else we've seen in the past, and even worse, fentanyl in particular. We find it in places that the people consuming it had no idea that it was there. And this is a one-dose killer. This is a one-time, one-dose killer, unfortunately.
Yes, and that's where we're seeing a dramatic increase in numbers. We've seen about a 60% increase in the people that aren't actively using on a regular basis. They're buying one thing that they think might be another, and they're coming into contact with this accidental exposure. And we have gone through these waves, and you are correct. We went through a crack epidemic, a meth epidemic. This is very different because those particular substances in the system did not create fatality rates like we're seeing today because there was no fatalities associated with some of those other drugs that you were speaking of.
Well, and you may not know that fentanyl is in the drug that you have been, maybe you've been consuming it across your life or across some recent period of time, and
Yes.
and maybe you get a dose that has fentanyl in it. One of the other things that you mentioned that's part of these available resources are some testing materials. Talk about that a little bit, and that can be a really great preventative tool as well.
Yeah, so as we move into the arena of reducing harm, one of the tools that has been most effective is being able to provide a testing tool, which is a fentanyl testing strip, to actually test substances prior to ingestion. So we're having an honest conversation that we know people are sometimes going to experiment with drugs. What we need our people to know, or the community to know, is that those risks are a lot different than they used to be. We now know that 77% of all substances out there on the street contain deadly doses of fentanyl. And if they make that choice, we want them to be able to test those substances prior to ingestion to kind of mitigate the fatalities as a result of not knowing what they're ingesting.
Listen, I'm 110% behind what you're doing, but I'm sure every once in a while you get some people saying, well, you're putting test materials out there. That just encourages drug abuse. And
Sure.
people make all kinds of crazy arguments about all kinds of things, but I'm sure you hear that.
I do. I hear it a lot. And it's something that I try not to get too frustrated with, because the reality here is that we heard that message with Narcan years ago. And what Narcan does is it enables breath, it doesn't enable using. And these products, all of these tools that are available to us, what it does is uniquely different than what it was, than maybe what it's perceived. And that's keeping people alive long enough to make the choice to help themselves. And I can only speak from my own experience as someone who used substances for a long time and is now about 9 years sober, that those choices for me were a little bit easier because I wasn't risking death at that type of rate like we are in 2023, 2022, 2021.
Yeah, I mean, listen, what is going on right now is so scary and so fatal. And, just anything we can do to let people know to be careful. You just can't consume anything without the assumption now that if you didn't get it at the drugstore and it's not clearly labeled and you didn't get it yourself, then you just can't take it anymore. It's just too dangerous, right? And you have
Precisely,
no
yeah.
idea. You can't, maybe a couple of years ago, you could have gotten something from somebody and you're not supposed to do that, but, it wouldn't have been the end of the world probably for you. But now you just can't.
Right.
You just can't. You just can't because it could be fatal for you.
And that's exactly what these tools do for people. They keep them alive long enough to, if they do make a bad choice, it's not the last bad choice they've ever made.
All right, Steve. Well, I appreciate you joining us. And just for clarity for our audience, Steve Norris, you're with, as it says in the bottom of the screen here, the Alliance of Coalitions for Healthy Communities.
Yes.
And you guys are putting these materials out for people free of charge, accessible, don't need to go anywhere where if you want to be anonymous, it couldn't be easier, right?
Absolutely.
Okay, and in our community, we've got a press conference coming up on Friday with locations, but can you share any of the locations where people will be able to go, or how do we get that information?
Yeah, so these stations will be specifically throughout all of Oakland County. However, Greater West Bloomfield will be the first to deploy. Those stations will be available. They'll be at each individual fire station throughout Greater West Bloomfield, as well as the libraries and the Parks and Rec building. We're expanding that as we go, but again, we don't want to oversaturate the market. I think that at this point, we've all determined that our initial rollout of 10 to 11 Save a Life stations will be an appropriate amount for the community of Greater West
Well,
Bloomfield.
that's a great start, and that gets us all across West Bloomfield. And, I saw some of the pictures. These almost look like one of the old newspaper boxes. Is that a good description?
Yes, it is a great description. And the best part about this is a low cost option to what we've seen out in other areas where people have implemented and deployed actual vending machines that dispense Narcan free of charge. Those machines could be at a cost of upwards of about $6,000. These newspaper boxes are so much more cost effective, and they're easier to deploy, maintain. Our staff is going to be out, making sure that they're stocked up and they're never out of materials at any given point. So
Looked just like what we had on TV a minute ago. Thanks, Jared, for putting that there. Steve, I know you're tight in time today. Thank you so much for coming on here with this important message. Good to talk to you. Keep up the good work. And again, thanks for your time today.
Thank you so much. Have a wonderful afternoon.
Thank you.